afternoon. It's time for our Friday Facebook Live. And I've got some kind of fun stuff. It's serious, but it's kind of fun with this COVID-19 thing. I mean, there's so much going on. If you're keeping up with the news, you're seeing that the people that are getting the virus, the vaccine, they're having all kinds of complications. And so I don't really want to talk about that because I've talked about that ad nauseum, right? You guys are just going to have to make up your own mind about whether you want to get this vaccine or not. But I do want to talk about masks and how I feel about masks. We're going to put some links in the comments so you can go and read some articles about masks and when masks are effective and when masks are not effective. So we're going to start with that news. And we're going to move a little bit on to the 98 different lingering effects of coronavirus. Now, I do believe there is such a thing as coronavirus. We've had coronaviruses for years. The common cold is a coronavirus, okay? So there are definitely people that are having some hard times with this, and so now more than ever, you need to keep your immune system strong. So this is an article that says, now my husband is sending me all this stuff. I don't know where he's getting this. He's getting it off mainstream media, and so you're gonna have to just take that with a grain of salt, but this is really important. Just full disclosure, Steve and I do not wear masks. We just don't. Why do we not? Well, we don't because, number one, we like to breathe. And when I put on a mask, I start hyperventilating, I start sweating, and anxiety is just like out the wazoo. So I don't wear a mask for that reason. Another reason I don't wear a mask is because when I exhale, I'm exhaling bacterial particles, and I do not want to have them in the mask and me rebreathing those, okay? This is a real deal, and there are about 5 different scientific articles I'm going to post at the bottom of this video that say masks are not effective. Wearing a mask is not, N-O-T, not effective with respiratory viruses. So for that reason, we follow the science, right? And so because I follow the science, I want to do what is good for my body, and my body has to breathe and have a good exchange of carbon dioxide and oxygen in order for me to be healthy. So this is a study, health officials, and they're talking about basic health guidelines. There's a new study that says wearing a used or worn out mask could actually be worse than wearing no mask at all right? So if you're going to wear a mask, and this is definitely a free country still, if you want to wear a mask, I have no problem with that. But if you don't want to wear a mask, I have no problem with that. But if you're going to do it, then you want to do it in a safe way. So you want to wear a clean one every time you put one on. It says that there was a new model, a medical model, and it was asking or showing how these virus particles react. It says the model shows that where the particles landed on the face, in the nasal passages, and how they are distributed into the lungs and the pharynx. The research determined that a new 3-layer surgical mask is 65% effective in filtering particles. But if the mask is worn out, the number drops to 25%, and in fact, the researchers found that a worn down mask led to the wearer inhaling more particles than those wearing no mask at all. So, I don't know how many of you have 3-layer masks. I don't know what you're doing. I know a lot of people, you know, have their mask, they have it in their car, they use it, they put it back, they use it, they put it back, so it's not clean. And so those are the kind of things that we want to make sure that if you're doing this, that you're doing it intelligently, right? The research shows that the masks only filter out particles larger than 5 micrometers. Now, I looked at what the size of the coronavirus particle is. It is 3 micrometers. So what they tell you on the box when you buy those paper masks, that this is not effective against coronavirus transmission. You need to believe that, and you need to ask the critical thinking question, why are they wanting me to wear a mask? Just gonna throw that out there. So the masks can mess with your sight. Wearing a facial mask makes the exhaled air go into the eyes, wrote Dr. Antonio Lazzarino. I might not be saying that right. He is a medical doctor and epidemiologist at the University College London. He wrote a letter to the British Medical Journal about the side effects of face masks. This generates an uncomfortable feeling and an impulse to touch your eyes. When you do that, your hands are contaminated and you are infecting yourself. Okay, so we want to make sure that that is something that we take care of. It says it makes you feel uncomfortable. When you're uncomfortable, you touch your face, you contaminate your mask, and therefore your mask is not effective. It can restrict your airflow. It says facial masks make breathing more difficult, and this chronic obstructive pulmonary disease, COPD, okay, causes decreased airflow. Face masks are, in fact, intolerable to wear as they worsen your breathlessness. Moreover, a fraction of carbon dioxide previously exhaled is inhaled in each respiratory cycle. These two phenomena increase breathing frequency and deepness, hence they increase the amount of inhaled and exhaled air. That's really important. He said, the quality and volume of speech between two people wearing a mask is considerably compromised, and they may unconsciously become closer. Now, we had this over at my mom's the other day. She is immunocompromised. She's a cancer survivor. Thank God she's still with us. And, you know, everybody, I had a mask in front of my face, but other people in the room had a mask, and Mom was consistently saying, what? I can't understand you. What? And so that is something that the mask muffles the sound. And so if you're muffled, you're going to get closer. You're going to incline. So you want to hear a little bit better. So that cuts down on the safe distancing. So just be aware. If you're wearing a mask or you're with people, just be aware that you're not including or intruding on that space. It says that wearing a mask can foster a false sense of security. Don't think of your face mask as Batman's cowl, some kind of bulletproof covering to protect you from the virus. Okay, so that's really important to understand that. And it says that masks can hurt children under 2 or others who are incapacitated. Now, I know we all saw this week, or maybe it was late last week, of this family that was on an airplane with a 2-year-old. The 2-year-old refused to put on a mask. They made the family exit the plane. It says it can hurt children under 2. We've had this information before from a neurologist who says that when you have a mask on, you're restricting your breathing and you are damaging your nerves in your brain. So she asked us not to do that. And she is a neuroscientist, so we need to kind of pay attention to what she says. It says they cause skin irritation. It says if you have dry skin, it's best to put on a moisture before the mask. This can perhaps prevent the skin irritation where the mask rubs your face. It says also don't wear makeup. Well, this is the thing, right? If you do wear makeup and you put your mask on, it's going to wear off onto the mask, it's going to contaminate the mask, and then therefore how effective is your mask because it's already contaminated with the makeup. Just thinking. It says that when you're wearing makeup with the mask, it leads to decreased air filtration, making it harder to breathe. So those are just some common sense things that I want you to think about. We want you to be healthy. We want you to, if you're going to wear a mask, then you want to wear a good one. You want to wear one that is clean. You don't want to reuse your mask. You don't want to touch your face. You don't want to get too close to other people who might be contaminated. Just throwing all that out there. Now, this is a study that it's called the Long Haulers Report, okay, which discusses a variety of side effects from COVID-19. And this was published on December the 10th. And it is from a Dr. Natalie Lambert of the Indiana University Medical School and Survivor Corps. She analyzed the long-term experiences of COVID-19 survivors and what kind of hangs out after the virus. Now, I have to laugh about this, okay? I've been in education for a long time, and I did my master's work when I did my master's degree in education on attention deficit disorder. And so there are all these kind of list of symptoms that if you have these, then you could be a candidate for attention deficit disorder. Well, guess what? Everybody has those symptoms to a greater or lesser degree. When I'm reading through these symptoms here, everybody has these symptoms to a greater or lesser degree. So I think it's a little humorous, maybe a little bit ironic, right? Because as we're seeing more and more cases, we're seeing people that are testing positive that have absolutely no symptoms whatsoever, right? So this makes me just a little bit tickled. And I'm going to read, I don't know how many, I've got about 15 minutes left, and they're 98. So we're going to kind of just run through this. There's some that I'm going to spend a little bit of time on, because if you have this long-term side effect after the virus, and this might be something that you need to seek some medical attention, because it could be quite dangerous, okay? So of the 98, and we're going to do like the Casey Kasem, you know, the top 100, and they go from the bottom to the top. That's what we're doing here. So 98, okay, is syncope. This is fainting. People reported this symptom after they had the coronavirus, and it is due to a temporary drop in blood flow to the brain. This is according to the Cleveland Clinic, okay? Recognizing this as a possibility is of extreme importance, especially in the initial phases of a COVID-19 infection. So these are some kind of new things for me. I had not heard this before. Bilateral throbbing in the neck due to the lymph nodes being enlarged. We all can understand that, because whenever we got sick when we were a kid, mom kind of patted us here to see, and if it was like, oh mom, that's tender, well, you know, you've got enlarged lymph nodes, we know that that is a sign of a viral infection. So that's not kind of new. Elevated thyroid. This was something that interested me, because when we look at people, we look at their blood work, we look at their thyroid, and kind of move on from there. It says your thyroid is an essential element to your body's proper functionality, according to Informed Health. Quote, it plays a major role in metabolism, growth, and the development of the human body. It does this by releasing the perfect amount of thyroid hormone at the perfect time. We know this. Some COVID-19 sufferers report as having elevated thyroid levels as a long-lasting symptom of the virus. So if you have coronavirus and you go get your blood work, and your blood work shows that your thyroid is elevated, it's just a long-lasting side effect of that. Doesn't mean you shouldn't take care of it. You need to take care of it, but this is something that I would never have thought that this would be a side effect of coronavirus. Anemia. Anemia is a condition where you lack enough healthy red blood cells to carry enough oxygen to the body's tissue. Now, we know that there is a degree of hypoxia, lack of oxygen, in the coronavirus sufferer. So this is a longer term side effect. This condition makes you feel very tired and very weak. In some cases, it may even cause chest pain and dizziness. Okay, these are common long-lasting symptoms of the coronavirus. So this one is interesting. Herpes, Epstein-Barr, or trigeminal neuralgia. Now, trigeminal neuralgia is a condition where you've got your cranial nerves that go in the back of your brain, they wrap like fingers around your face, okay? I think there's 13, but don't quote me on that. It's been a while since I looked at that. But trigeminal nerve pain, your face is very, very painful. To eat is painful. There are just a lot of things that go with that. So herpes and Epstein-Barr virus. So the symptoms are varied and may include fatigue, inflamed throat, fever, and facial pain. These are normal side effects of having a COVID-19 infection. The next one, GERD, okay? This is gastroesophageal reflux disease, okay? So we normally call this reflux. This is something that people are finding at the University of Florida Health System, says that the trauma or the infections in the throat, such as sinus infections and swollen adenoids, can also cause GERDs. So all of this is part of the COVID. It's all part of the virus. So just be aware if you suddenly have these symptoms, it could be because you have not cleared the virus effectively. It might be something that you need to look on. It's an interesting thing for me, okay? Personality change, drastic personality change. It says that the scientists are studying the rare but potentially severe personality changes that COVID-19 may cause in patients. According to an article in the Science News, symptoms related to the brain are often overlooked by medical professions who focus only on the physical aspects of the virus. So look for depression, personality changes, and confusion as some of the longer lasting symptoms of COVID-19. So if you have somebody in your family that has had this virus and you see that their personality is changing, don't be alarmed about that, but just be aware that this could be a side effect, and just, kind of monitor to see if you might need to look at some mental health help here. Okay, another symptom is thrush. So this is a coating on the tongue or in the inside of the cheek, small white lesions caused by an imbalance of bacterial growth. Now this could happen because of the antibiotics that they give you, if they give you antibiotics if you've been hospitalized. I know that sometimes when you go to the hospital with COVID-19, they'll also find that you've got pneumonia, so they'll give you antibiotics for that. The antibiotics can cause the balance of your probiotics to get out, and so thrush is a side effect. This is reported by the Cedars-Sinai Hospital, and it says it's very common, but you need to take care of it, okay? That was 91. 90, hormone imbalances. Now, why would your hormones be imbalanced because of COVID-19? It says that because the virus weakens the respiratory system and your immune system has to work so hard that it throws your hormones off. They're not saying how they know this. They're just saying that it is a stress response. So I know that it is stressful. When people have this, it's stressful. Hey, just listen to the news right now. It's stressful. So you want to make sure that if you see this, if you stick out your tongue and your tongue is all white, then you've got that bacterial imbalance and you want to take care of that, okay? People have UTIs as a result, and I'm thinking that that's also maybe a result of the antibiotics that they give you for the other infections. It says that this is found, and it is potentially a dangerous overlap of classical urinary symptoms and as yet not fully described in the COVID-19. It says urinary frequency and viruses may be related, which explains the potential cause of UTIs in patients. Now, I'm always looking for bacteria in the urine when I'm looking at UTIs. So just be aware that this is a side effect of a COVID-19. Also, kidney issues and protein in the urine. This is something else that is a side effect. It says the specific ways the virus affects the kidneys is not yet known, but according to Johns Hopkins medicine, it may invade the kidney cells, or the low levels of oxygen that the virus causes may be what contributes to these long-lasting kidney problems. So this is important. One of the health markers that I'm always looking for is what is your kidney function. So if you've had COVID-19, if you are having a lot of urinary frequency and that kind of thing, you might want to look here because this could be a longer lasting side effect and you might need to do some medical intervention here. Dandruff, okay? Now, how many people do we know that have dandruff, okay? A lot. This is something that we see a lot, but now they're saying that this could be something that comes as a side effect of COVID-19. It says it can be caused by the changes of the hormones, and we know, as we read earlier, that your hormones are challenged when you've got a virus. Low blood pressure. So Mayo Clinic says that low blood pressure often is related to infections and hormone fluctuations, all right? COVID toes. Now, COVID toes, I thought that was very interesting. This is an emerging system of the virus that may not be as common as other symptoms, such as a cough or fever. COVID toes occur when the toes develop rashes or lesions. Now, this also is from the Cleveland Clinic. When people have COVID toes, then they also are going to have foot pain because they're twisting their foot or they're babying their foot because their foot hurts, so it's going to cause all kinds of other issues that are going to be there because of this. So, I mean, that's why it's somewhat humorous. It's not humorous if you have it, and I apologize if I'm being offensive here, but I'm thinking of all these seemingly unrelated things that you could have even had before you had COVID, okay? There could be things that were latent that you thought were just part of who you were, and then you get this infection, you're dealing with this high stress, you're dealing with all of this that's going on. Then when you clear the infection, you might notice that, oh, these other things that you didn't realize you had before. So it's really a little bit comical to me. There's always medical intervention. There's always holistic intervention. Just need to look at that. So styes. Now, eye infections. Now, this makes sense if when we're wearing the mask and we're breathing the bad bacteria and it's getting into our eyes, this can kind of go along with that. I see how that's possible. I listened to a medical professional the other day talking about masks, and he said when you're breathing through a mask, it is catching your bacteria, because when you exhale, this is how we get rid of the bacteria. You're taking this bacteria, and he said most of the bacteria is staph. Okay, we all know all of our bodies have staph, all of our bodies have strep. It just is who we are. It's part of the microbiome. When it gets out of balance, then you get an infection. We don't want it to get as an infection, right? But when you're breathing and it's collecting and it's getting higher numbers, and then it gets in the nose, those particles get there, and then the medical professional said once they then stick that Q-tip up, it's covered in that bacteria, and he's concerned about long-term brain effects for the people that have had that COVID test right into the brain. So just telling you, this makes sense to me. I want to be able to breathe properly, right? I know that respiratory, I'm breathing in, I'm breathing out carbon dioxide. I want to get that out. I want to get out all that contaminant, those environmental contaminants that I have breathed in. I want them to breathe out. I don't want them to breathe into a reservoir, and then when I'm inhaling, I'm sucking them back in. Just throwing that out there. A goiter or a lump in the throat. Now, this would be related to the earlier symptom of thyroid disorder. Cracked or dry lips. Now, you know what? I have not cracked, but I have dry lips all the time. I'm always putting something on my lips. So it makes me just kind of smile a little bit. I know I've not had COVID. I've not been tested. I've not had symptoms. So, have I had a cold? I haven't had a cold in years, right? But apparently, cracked and dry lips are a leftover from COVID-19. It says this is likely to occur because of dehydration. A cold burning feeling in the lungs. Okay, a cold, burning feeling in the lungs. COVID-19 is a respiratory virus, so it's no wonder that those who have contracted the illness feel a cold or burning sensation in their lungs. However, this symptom may last longer than the virus, and people are reporting feeling this even after the coronavirus is gone. This was according to an article published in the NBC News, and it concludes that many COVID-19 sufferers may have a slow burn for a while until either it worsens and was treated or goes away completely. So if you have this, if it lasts for a long time, you want to seek medical attention. Low blood oxygen, we talked about that with hypoxia. Arrhythmia. Now, arrhythmia is an unstable heartbeat. It can produce a high pulse rate. It can be skipped beats, all kinds of things with the heart, right? So the Mayo Clinic defines arrhythmia as heart rhythm problems and explains it happens when electrical impulses that coordinate your heartbeats don't work properly, causing your heart to beat too fast, beat too slow, or irregularly, okay? This study studied hospitalized coronavirus patients and found some of them suffered bradyarrhythmias or cardiac arrest, right? The study concludes heart traumas and anomalies like these are likely the consequences of systemic illnesses, not just COVID-19. And we do know, and we do agree with the professionals that say if you have the comorbidities, cardiovascular disease, COPD, obesity, diabetes, that you're going to have a worse time with coronavirus. So I think that the people that have this probably had ongoing heart issues before, maybe not have been diagnosed, okay? I mean, I'm surprised at the people that come in to see me. When was the last time you had your blood work done? Oh, 5 years, 10 years, right? We want you to have blood work a little bit more often than that, all right? So I'm just throwing that out there. You can go on not our Facebook page, but on our web page. If you go to the top of the banner, there's a link. It says links. You click on the links. You can pull down that menu. The very first thing that you're going to look at is Ultra Labs. You can go ahead and order your own blood work. It's much cheaper than walking into a clinic and getting it done, like going into Quest or whatever. You can do that. You need to know what your numbers are so you know what your body is doing, okay? Jaw pain. In the survey, people reported jaw pain as a long-lasting symptom. They say, the American Dental Association, jaw pain may be caused by bone problems, stress, infection, sinus issues, or tooth grinding. It is known that coronavirus causes aches and pains, so the jaw pain may be a lingering side effect of the body fighting off the virus. Painful scalp. Let me see where I am. Painful scalp. This is associated with a high fever. Burning sensations, we talked about that. Mid-back pain at the ribs. All right, the National Institute of Neurological Disorders and Strokes says that back pain intensity can range from dull, constant ache to sudden, sharp, and shooting pain. Those recovering from the illness may report pain due to the decrease in movement over the past few days or weeks, and it is due to the usual aches and pains of the disease. All right, so they usually treat this with massage, muscle relaxants, stretching, heat, or ice. Abnormally low temperature, okay? After potentially experiencing fever while fighting off COVID-19, sufferers may be surprised at a long-term symptom of low body temperature once they have recovered. This could be related to the thyroid issues that we talked about earlier. So we see, this is the thing with holistic people. Holistic people see you as an integrated whole. So if you have a primary respiratory virus, it's going to affect all these other things, and you need to be aware of that. A lot of times people will think, oh, I had COVID-19. It's a respiratory illness. What are all these other things? Why am I having this? Because I had something that affected the lungs. Yes, you did. But you are a whole, complete person, body, mind, mental, emotional, and spiritual. All four of these are connected, and your well-being is connected to being balanced in all of these areas. So it's not unusual for you to have other body parts suffer because one part is suffering. I think there's a Bible verse that goes along with that, okay? Bulging veins, wrist pain, okay? I'm going to say this word. I may not say this right. Costochondritis. Okay, that's a big word. This is inflammation of the cartilages in your ribs that connect your ribs to your breastbone. This is because you have a respiratory infection, okay? The Cedars-Sinai people claim that the risk for developing a chest wall infection is increased with respiratory trauma such as pneumonia or bronchitis, all right? Since COVID-19 is a respiratory illness, it's not surprising that people had this as a lingering system. Yes, I can post this report. I sure can, Michelle. So there's just tons of stuff. Spikes in blood pressure, kidney pain, brain pain and pressure. Now, why would you have brain pain and pressure? Well, you could have that because you have swelling in the brain because of an inflammatory, because of the fever, okay? All of these are very important. Extreme pressure at the base of the head and the occipital nerve. Feeling of burning skin, bone aches in the extremities, phantom smells. Now, we do have people that they've not been diagnosed with coronavirus, but they have reached out to me and said, Dr. Polly, I smell this nasty stuff. What is this? It's like, I don't know. You know, it could be a detox reaction. It could be this. It could be that. We need to do some other things. Well, according to the Mayo Clinic, okay, this condition is a olfactory hallucination, and they're commonly caused by respiratory infections like a virus. So a hot blood rush is a side effect. Chills but no fever is a side effect. Neck muscle pain is a side effect. Mouth sores or a sore tongue is a side effect. Swollen hands, swollen feet, dry, peeling skin. All right? High blood pressure. High blood pressure is not a documented symptom, it says, of COVID-19. This is according to A&D Medical. All right? But it can be exacerbated with a virus. So this is probably a pre-existing condition that the virus makes worse. So you need to know that if you have high blood pressure. So I've gotten down about halfway through my list, all right? So I'm going to post this in the comments. You can look at this. You can read this. Just be aware if anybody that you know has had the coronavirus, or you think that you've had the coronavirus and you've got some lingering things that are hanging on, look at this list and see, and you'll see kind of where you are. I could not find out how many participants they actually surveyed, but what I did find that one of the symptoms that had the most participants was 1,567. So I would imagine the group who took the survey was larger than that. Not quite sure how many. They don't tell us how many they tested, but I would imagine it was about 2,000, since we had over 1,500 have some of the same and similar side effects. So we'll post this. Look out for your health. What do we want to do when there's a virus running around? We want to make sure that our immune system is not compromised. We want to make sure that we take our vitamin C. We want to make sure that our vitamin D levels are high enough. Holistically, they tell us that if your vitamin D is 60 or above, that's 60 nanograms per deciliter, that you cannot get the flu, you cannot get depressed, right? There's other things you can't get if your vitamin D is that high. Now, medical professionals are very hesitant to tell you what your vitamin D level is. It's an extra expense. Your insurance won't pay for it. Why won't they pay for it? I don't know. It's a very intense, I say intense, biomarker that tells me where your immunity is. On that link that I told you about a while ago, you can get a vitamin D test. I think it's for $39. It may even be cheaper than that. Okay, so that's really important. If you're on your medical reference range, it'll say as long as you're above 30, you're good. I'm just telling you, holistically, we want you to be 60 or above. Okay, because when you're 60 or above, you're going to be very resistant to the flu. What is a coronavirus? A flu virus is a coronavirus. A common cold virus is a coronavirus. These viruses mutate, okay? There are different permeations of them every year. If your vitamin D is high enough, you're going to pretty much be immune to that, okay? So just throwing all that out there. I know people have been commenting. It's hard for me to read that and read this, and so forgive me for not commenting on your comments, okay? I definitely will be reading them. I will be responding to them. I do appreciate all of you that are on. I do appreciate your shares. I appreciate your comments. I appreciate your tagging people that need this information. And again, it's for your education. The more we know, the better we can do. I am responsible for my health. You are responsible for your health. There's a lot of conflicting stories out there. There's a lot of yik-yak out there. There's a lot of stuff out there that, you know, Dr. Google, which Dr. Google doesn't really impress me. But when I'm reading this and I'm telling you the sources, right? And this may be multiple studies that were done because of the different sources, you know, Cedars-Sinai, the Cleveland Clinic, Northeast Medical University, University of Florida. So there are all these different entities that are giving us this information. And so for us to be wise, okay, about that and to supplement and support our immune system. What else supplements and supports our immune system? Being with our family, okay? Having fun, de-stressing, self-care, all those things really help strengthen our immune system. So when we come into a challenge, right, we're able to mount a defense and we're able to ward that off. And so that's what this is all about. How can you be your best advocate? How can you do what's best for you? Listening to all the advice, picking out what's good for you, and then acting on that accordingly. So next Friday is Christmas Day. I will not see you. Why is that? Because I'm going to be with my family. I'm going to be enjoying my family, taking a lot of self-care next week. The clinic is open Monday, Tuesday, Wednesday. We're closed half a day on Thursday. We're closed on Friday. The next week, Friday, is New Year's Day. Guess what? I'm not going to be here because I'm going to be with my family doing self-care and that kind of thing. So love you. Take care of yourself. Enjoy the season, however it is appropriate for you. I hope you get lots of hugs and kisses. Hopefully they're not all virtual. All right. I hope you have some skin on skin because I think that that's just really good for your immune system. Love you guys. Thanks for joining me. Have a great weekend. See you in a couple of weeks. Bye-bye.